The Student Commons is one of the last buildings at the University of Toronto that requires masking up.
A lot of students are either immunocompromised themselves or have immunocompromised family members.
And the Student Union is already planning for the fall.
We are having the vaccine clinic open here, and I'm sure a lot of students will be taking advantage of that opportunity.
After weeks of mounting pressure, they'll be able to get a fourth shot, too.
We've made the decision to expand the eligibility for second boosters to include Ontarians aged from 18 to 59.
But Ontario's top doctor said just because more people could get the shot doesn't mean they should.
It's not an obligation to get a booster dose if you're young and healthy and have no underlying risk.
Made all the more confusing when the federal health minister gave this advice Wednesday afternoon.
Our recommendation is that all Canadians should be up to date in their vaccination, which means that you should get a booster shot no later than 9 months after your last vaccine, regardless of how many booster doses you have received already.
And advice and access to fourth doses is inconsistent across the country. Besides Ontario, only BC, Yukon, Quebec, and New Brunswick have expanded eligibility to all adults. In PEI, kids 12 and up can get it too. Everywhere else, it is more restrictive. For some Ontario frontline workers whose immunity has been waning, the choice is clear.
There's no ambiguity for me. It's just get your next booster.
And Canadians will soon have a new vaccine to consider, the first one tailored to emerging variants. Ontario's Chief Medical Officer of Health says even if people get a fourth dose right now, they can still get one of those new shots in the coming months when they become available. Katie Nicholson, CBC News, Toronto.